morning. I'd like to call to order this regular meeting of the Lane County Board of Commissioners for Tuesday, December 11th, 2018. And we have a time certain public hearing we are going to handle first as our first item of business under County Administration. And that's public hearing and order and resolution 1812-1101 in the matter of adopting the FY 18-19 supplemental budget number 2, making, reducing, and transferring appropriations. And we have Christine Moody, our budget and financial planning manager. So I'll turn it over to you, Ms. Moody.
Good morning. Thank you, Chair Bozovich, board members. So as mentioned, this is your second supplemental budget of 18-19. We typically do 4 supplemental budgets throughout the year. I want to highlight just a few things for you, and then I do have one verbal change to the board order as submitted. So this supplemental will increase resources by about $32.1 million in the county's budget. That is primarily related to carrying forward fund balance from 17-18. So wherever we ended up as a final number, we adjust the budget in 18-19 to carry that cash forward. There is a change of 35.9 FTE. That I'd like to highlight a little bit for you. There's 15 FTE being added to the Sheriff's Office levy. That is 10 deputies, 2 sergeants, a security officer, an admin support assistant, and a records officer. Those additions are just because of the increased demand of having more beds in the jail filled. And they've just realized that they need additional security measures and when they're moving the inmates around the jail or transporting between facilities. There's also an addition of 2 FTE in the Land Management Fund, 12 FTE in the Road Fund. 8 of those FTE are in the Design and Construction Services and 4 are in Road and Bridge. And then 16.19 FTE in Health and Human Services in various programs throughout their fund. The one I want to highlight for you that's a change of the board order as submitted is that we need to adjust so that County Administration in Fund 124 adds 0.5 FTE. No dollars associated with that, so this only changes the FTE as stated in the memo and order. It'll change it so that you have a grand total new FTE for the county of 1648.98. And that 0.5 FTE is being added in the capital projects area. We have somebody who's been working in a 0.5 position in that department and 0.5 in another department. We're just combining that into this program. And that's all I have.
Questions for staff on the supplemental budget? I just want to make one notation. With this budget, we're adding an additional $32 million, which takes us beyond the $700 million mark annual budget, all funds. So remember my first year on the board, we went from $600 million back down to $480 million all funds. So we've kind of climbed back past with the cuts and exceeded it at this point, which is a good thing. And it's also really great that this budget's adding back in those positions in Public Works due to the House Bill 2017 that Commissioner Lycan was so instrumental in lobbying for, and that's getting us back into everything from more mowing and maintenance along the right-of-ways to more paving, restoration, and bridge work. So really good news all around on this budget, supplemental budget. So if there's no questions for staff, I'll look for a motion to approve the supplemental budget number 2 as amended to add the extra half FTE.
I think you opened the public hearing.
Oh, gosh, sorry. I'm jumping ahead of myself. I need to open the public hearing for supplemental budget number 2. Anyone signed up for the public hearing for the budget? Thank you. If there's no one here that wants to address the board, I will close the public hearing for supplemental budget number 2 and turn to the board for a motion. Commissioner Lycan.
Thank you, Mr. Chair. I'd like to move approval of order and resolution 1812-1101, the matter of adopting the FY 18-19 supplemental budget number 2, making, reducing, and transferring appropriations, and with also the added piece that Ms. Moody added into during the narrative.
Second.
So it's been moved and seconded to pass supplemental budget number 2 as amended to add the half FTE in county administration. Discussion to the motion. Seeing and hearing none, I'll call for the vote. All those in favor, please say aye.
Aye.
Aye. Any opposed? The motion passes unanimously. Thank you, Ms. Modi. So we are going to now recess the Board of Commissioners' regular meeting and reconvene as the Board of Health. So I'm calling to order the Board of Health for Lane County for Tuesday, December 11th, 2018. And the first item is adjustments to the agenda. Any adjustments to the agenda for the Board of Health? Seeing, hearing none, we'll go to public comment for the Board of Health, and I believe we've got some folks signed up. And our first person signed up, and there's actually somebody also signed up for public comment for the regular board meeting. And with the approval of the board, we only have 2 people signed up for public comment. I'd like to take public comment for both the Board of Health and the regular board now, so we don't force those people to wait through the entire Board of Health meeting to get to the other public comment. So the first person I have signed up for then, I'll take Sue Barnhart first. So Sue?
Thanks, I appreciate that. I do have some other things to do today. So I wanted to thank you all for your service, and I'd like to thank you all for being able to use that land as soon as it was available out of 99 to help folks who are unhoused. I'm hoping that you all can also use the Armory as a shelter, at least this winter, because I know the Armory, we're deciding what to do about that, whether or not to fix it and maybe have where I used to work, developmental disabilities move in there, or maybe tear it down and start over. But it seems like right now, in the middle of winter, when it's so cold and so wet, it would be nice to have it open as a shelter. And I want to thank Pat Farr for working on that this summer, and just urge you all to do the right thing right now when it is so cold. Thank you.
Thank you, Sue. That was the only person we had for general public comment. We have Carson Lydon. Lyden, sorry, thank you. Thank you. Carson Lyden for public health. So Carson.
Mr. Chair, real quickly, if you don't mind, I actually asked Carson if he would come this morning and present to the board. And so, of course, it'll be up to you and as board chair, but in case he goes over 3 minutes on what he's presenting, just want to make sure that, you're aware as well. Thank you, Mr. Chair.
Thank you. Go ahead, Carson.
Hello, my name is Carson Lyden, and I came here to present to you what I have been doing in the community, as well as how our youth are creating a change in mental health in Lane County. Recently, I was awarded the National Highlight the Hope Award for my work in mental health. The reason I won this award was primarily focused on my work with the American Foundation for Suicide Prevention. I created a team and a fundraiser called the Out of Darkness Walk. The Out of Darkness Walk is a community-based fundraiser created by the American Foundation for Suicide. The whole primary focus of the walk is to bring people together to grieve over their losses, as well as kind of find a hope for the people that are still struggling with mental health and mental health problems. My team I created was called A World Free of Suicide, and it had a total of 350 members present, as well as over 1,000 supporting via social media. So my team, as a whole, raised $17,000 in memory of my friends that I lost to suicide, Will Manson-Green and Christine Tofty. So the $17,000 was not only the highest raised in the state of Oregon, but it was actually the highest raised in the United States. With this amazing accomplishment, it brought lots of media attention, which helped my mission reach more and more people. My mission is one day to not have one person feel the way my friends felt when they decided to end their own life. The youth of Lane County are ready to make a change in mental health and hope that one day we can make this county and this world free of suicide. I want to thank you guys for your time.
Thank you, Carson. So that was everyone I had signed up to speak for public comment. I'd like to turn to commissioners for remonstrance, and I'll start out with Commissioner Lyken.
Thank you, Mr. Chair. And Sue, thank you for coming here this morning. Appreciate it, and appreciate your passion as well. But I would just want to have the opportunity to speak to regarding Carson and really the commitment he's made. He had testified before this board before, probably, it's been less than a year. Has it been a year? Less than a year, yeah. Time goes by really fast, so. But he testified along with some other youth about the work that they're doing to help prevent teen suicide. And what I am really pleased about is Carson not only is talking, but is acting. And the work that he's doing, and you're a sophomore, is that right, Carson? He's a sophomore in high school, folks. This is the future leader of our community right here. And so, frankly, lets me know that we're in good hands in the future. But I just want to make point to the fact that Carson is acting, and that this is exactly things that we need. And those who get through to teens more than anybody else is not us, not the gray hairs. It's going to be people like Carson and people in school, and really getting through to those who maybe feel like that there's no hope left in the world, but yet there is. And I just want to say thank you to Carson, and thank you to his parents, who are, Jennifer's here this morning, and along with your sister, and Grandpa is here, and so it's really, really great to and younger brothers here. So, and do we want to just introduce? And so, no, I didn't think so. But just so you know, I don't know if you knew this or not, but Carson's great-grandfather, who's still quite living, and is a real business icon in this community, Ross Murray. And so, and I've gotten to know Ross quite well over the last many years. And so, as you can tell, this is a family of action. And Carson, thank you so much for what you have done here, and what you're going to continue to do to really continue to bring awareness to this really difficult situation that's not only happening here in Lane County, but the state of Oregon and throughout the United States. And thank you so much for the action and what you're doing for this community.
Further remonstrance from the board. Commissioner Farr.
Thank you. And Ms. Barnard, I'd like to say that you signed up for regular public forum for the regular meeting, but really addressing the Board of Health was entirely appropriate for the things that you were speaking about. I sat in this hall last night. People were talking about health in this hall last night extensively. The room was overflowing twice. Overflowed, then emptied, then re-overflowed for a discussion regarding health of our community, regarding where people sleep at night predominantly. And you know, I wrote down a couple of quotes, and I'm going to share them right now. One of them is regarding the conditions that people sleep under, and something to remember that we don't think about quite often when we think about having to sprinkle a building or people can't stay there. When we think about keeping a building empty and dry while we wait for the best use, you know, when we don't think about the people who are living in the conditions that they're living in, somebody who only has a sleeping bag, if you give them a tarp, it's better. They're living better tonight than they were the night before. Somebody who only has a tarp, if you give them a little shelter over the top of their head, then it's better than the night before. And so on up the line until you get people into dry accommodations. And it really is a shame that any dry buildings, particularly public buildings, are dry and empty when people don't even have a tarp in some places and some conditions. And really, another quote is that for somebody who's been living in a sleeping bag, a tarp is like the Ritz-Hilton. Well, that's hard to imagine and hard to think about when we all have a place to sleep and lock at night and stay warm and dry. And when we think about, well, we'd rather use a building for this or that instead of what it could be used for immediately, which gives people a little taste of Ritz-Carlton, even if it's just for a very short period of time. Another quote from last night from a man from Whitebird. Whitebird and cahoots are tickets to nowhere without places to sleep. Another quote from last night is that really when it was from a member of our legal aid staff who went out and canvassed and talked to people who were living in homelessness. And what is the biggest issue for when you're in homelessness? Well, overwhelmingly, she said, sleep is the #1 issue. Just some place to sleep where you're not going to get woke up every 2 hours by the cold, by a train, whatever it may be, by somebody moving you along. The second is rest. just a place to sit and rest where you're not going to get moved along, so you can't sit there and rest. So what we have to do, and this is what we are trying to do at all times, but we really need to find innovative and better ways to do it. Our Board of Health, this is housing and sleep, is a health issue, and that's why I'm talking about it right now. We need to continue to find innovative ways to get people a little taste of the Ritz-Carlton. Now, the Ritz-Carlton to us may be actually the Ritz-Carlton, but the Ritz-Carlton to somebody who only has a sleeping bag is a tarp. Somebody who only has a tarp is a shelter that keeps our tarp dry. Somebody who has that shelter is a place to sleep at night where they know that they're going to be sleeping there tomorrow night. So, Mr. Mokaraisi, you are putting out great effort. You and staff are putting out great effort and really have been. This board, sitting here, this Board of Commissioners, has been very strong in pushing forward efforts to find innovative ways to put people in housing, and we will continue to do that. And I'd like to commend this board for the work that we have done in the last, I can only speak for the last 6 years since I arrived, but it did begin prior to that, and hopefully it will continue into the future. So I just wanted to mention this under the Board of Health because Donadia Green stood before us last night. She was the first person who spoke last night. She said, "I don't look homeless, do I? I'm a single mom with a child, and I am homeless." She said, "Because I want to be presentable in public, I find a way to make myself look like this when I go out in public. But really, tonight I know where I'm going to sleep. But for the future, I don't necessarily know where I'm going to sleep. Just want a place for me and my child to sleep dry." Last quote I have is one that we all know. It's this time of the year where we all sometimes, maybe some of us watch It's a Wonderful Life. George Bailey, one of the great characters of all time. What did George Bailey do for a living? Well, he built houses. That's what he did. Mr. Potter admonished him for it, thought that the houses that he built were for the rabble. Well, George Bailey said, this rabble that you're talking about, they do most of the working and paying and living and dying in this community. Is it too much to have them work and pay and live and die in a couple of decent rooms and a bath? Let's continue our work in that direction. Thank you.
Sorensen.
Thank you very much. I just want to mention that yesterday I took a tour of the Whitebird Clinic and over in near the university in the West University neighborhood. And first thing that struck me going into Whitebird is they operate a service for homeless people where they can get phone calls or at least phone messages. They can use the phone. They can access services if they can make phone calls there. And the entire, opening reception area was just jammed with people, like flowing out to the street. There were so many people there. And I also got a tour of their new dental facility. They've taken over a dental place in the West University area that was previously owned by Sacred Heart, Peace Health. They also are buying a building that they haven't yet opened, but it's in that same area. So they're really expanding. And one of their, and relevant to today's recognition of your accomplishments and award is they have a substantial suicide prevention effort going at Whitebird Clinic. And last but not least, of course, they have the Cahoots program that is operating and helping people with, people on the street that need assistance. They're either homeless, they have mental problems, they have substance abuse problems, and they're able to give some assistance to those folks and help the police in bringing a bit of tranquility to some pretty awful situations. Anyway, I really think that they've done a lot in this community, and it's nice to have a reconnection. It'd be nice if we could have, highlight other nonprofits, well, them included, but other nonprofits that are doing a lot of good in this community.
So I'd just like to say congratulations, Carson, on the great work you're doing and on the national recognition that you've received for the work you've done. Mental health and suicide are huge issues along with homelessness in our community. Report came out this morning, school district in my district is the number one district for housing issues for students in the state, at 1/3 that are recognized as homeless at some point during the year of their students in Mapleton School District. So as I look at ways to start resolving that, our push to try and look at things like accessory dwelling units in rural residential areas, which there's lots of rural residential around Mapleton, that may be one of those low-cost housing options for those folks. And some of that homelessness gets driven by mental health issues. We kind of see some of that in the behavioral problems we have to deal with when we are dealing with the homeless. But all of us should pay close attention to this issue of suicide. Statistics that have been brought to us looking back at the county over the years and across the nation, men continue to be at greater risk of suicide the older they get. So all of us sitting up here are actually at much greater risk of committing suicide than somebody as young as you. It's much more tragic when somebody as young as you chooses to end their life at the beginning. But that risk actually increases with age for men. Women somehow or another are smarter than us, and it actually starts decreasing over time. But for men, it continues going up, right up, through the age groups. In fact, my grandfather committed suicide at a very old age, partly because he was dealing with a chronic pain, degenerative spine issue that he finally just couldn't tolerate. And that's where you see some of that, and the depression that sets in with all that. So I really, appreciate the work you're doing, and, that the whole issue of mental health, whether we're helping with some of the Cahoots folks that are now actually coming to some of the high schools to talk to students, and that the support we've done as a board through the Human Services Commission for Cahoots and expanding. At one point, it was just one van. I don't know how many vans they're running now, but part of that expansion's been through county funding. And just, the 23-hour, quote, clinic that we're now running for crisis intervention, and all the other places we're trying to work on mental health here. But I really appreciate part of the biggest thing is just not hiding that and taking the stigma away from mental health and being able to discuss it openly. And events like your Out of the Darkness walk, help bring it out into the light and talk about it. And really, youth talking to youth is, Commissioner Likens right. We can, we're just kind of noise to teenagers. But teenagers really talking to each other is really important about those issues, and kind of knowing when your friends are getting, into despair and trying to help them out. So I really appreciate the work you've done. Congratulations on the recognition that you've gained from it. Amazing that you're just a sophomore. I thought you were a senior for sure. I just assumed it because you're so well-spoken and everything. So, of course, the older you get, the worse judge of age you get sometimes. You all just look young. But I really appreciate it, and thank you for coming today and allowing us to take a few minutes to recognize you and your accomplishments. I hope you stick around, because I think a piece of our public health update today is going to talk about suicide. Am I accurate? So you may want to stick around. We should be done with that by 10 o'clock. If you can hang till 10, we'll be discussing that. We got about, we're going to that item next. So any further remonstrance from the board?
Mr. Chair, if I just may add one thing really quickly.
Sure.
And I forgot to do this the first time. We have a really special person sitting in the audience. Each one of us has somebody driving behind us, I believe. And there's a driver in the audience right now. I'd like to welcome Debbie Lycan. It's good to see you. Thank you for being here. It's not often you sit in this audience, but I wanted to take this opportunity to say thank you for everything that you've done through Commissioner Lycan's mayorship, through his commissioner work, and the work you'll do in the future. Thank you very much.
So with that, if we're done with Commissioner's remonstrance, is there any emergency business for the Board of Health? No. Then we'll move on to our semi-annual Board of Health report. And we have Karen Gaffney, our Director and Public Health Administrator, Dr. Patrick Ludke, our Public Health Officer, Jocelyn Warren, our Lane County Public Health Manager, and Brian Johnson, our epidemiologist. And I will turn it over to Karen. Karen.
Thank you. Chair Bozovich and Commissioners, I also wanted to acknowledge Dr. Ludke, our Senior Health Officer, is also in the audience. So if you have any really hard questions, we'll be calling Dr. Pat up to the podium. Before I turn the agenda over to Brian and Jocelyn to talk about what's in our packet today, I wanted to take just a moment based on the public comment and your discussion during remonstrance to reflect on this question of health, since you're sitting as the Board of Health right now, and our responsibilities in the community to really improve health outcomes. And I was thinking about whether it was the conversation about Whitebird and the work that they do, the work that young people are doing in schools, that really it is a piece about partnership and leadership. And I think that as a Board of Health, you've really demonstrated both of those things. And in terms of improving health in our community, that is absolutely what it's going to take. The county and the staff certainly cannot do it alone. We do it with a whole host of partners in the community. And the leadership that you provide as a Board of Health is really critical to help shine the light on some of our most critical problems and help drive energy and resources. The need in our community is huge, and Brian and Jocelyn certainly will talk a lot about place and the impact that happens on individual health based on where people live. So the need is huge. We've talked about that. I know there's a lot of work happening specifically targeting housing and homelessness right now as a critical issue. And the energy that's going toward creative solutions is really huge as well. So I wanted to assure that those two pieces are working in tandem, that we acknowledge the need and really focus our resources on finding solutions and helping the community move forward. So with that, today we have a packet for you that includes updates on every division in Health and Human Services, which is our tradition for your semi-annual Board of Health. And then we've picked a couple topics to focus on in the cover memo and in the presentation. So we'll talk about place matters, which is really a core piece of public health and how we think about improving health in our community. And then also the board requested regular updates on our work around suicide prevention based on the report we brought you earlier in the year. So we'll take some time on that as well and preserve plenty of time for questions and discussion.
So I'll get us kicked off this morning. Really, as Karen has mentioned, we're going to spend some time focused on place. So we've talked a little bit in the past how health might vary across the county, in particular how there might be differences between rural and urban communities. But in particular today, we want to really sort of set the stage for those ongoing conversations, because what we know is there's a lot about where we are and how we identify with our communities, the structures, the policies, the choices we make that really establish those communities that impacts health. And we've taken some time to choose particular communities that really highlight that, mostly highlight the differences and strong differences that we can point to, but I think it's more of an ongoing conversation. I'll talk more about that. So we're going to talk about three things this morning. We're going to talk about the role of place. We're going to explore those differences that are really highlighted in a couple communities across Lane County, and then we'll provide some opportunity also to give you an update around suicide, and Jocelyn will speak to that specifically. So what I'd like to start with is the concept of place again. I know we've had this, bounced this back and forth a little bit with the board before and had these ongoing conversations, but really what we know is that research strongly shows that place and that health is strongly influenced not only by genetics or health care or access to health, but really by a long list of social opportunities, often what we've talked about as the social determinants of health. And in particular, when we connect that with identity and the communities in which we're connected, it even has a stronger influence. So much so that you may have already heard frequently discussed is that our zip code can be a very, very strong predictor of the potential health of a community. It boils very much down to where you live and the opportunities before you. So 3 things that really come together to create what we're talking about place today. It's the people, the folks that live there and make up the community and participate in the daily life there. We have, and then opportunity. So place alone, meaning just where you are and where you exist in the community, is not the full picture there. What we really mean when we're talking about place is those opportunities in front of you, including jobs and housing, employment possibilities, educational opportunities, all those things in your community that either are present and supportive and really enhance health, or all those things that might be getting in the way of making it possible to live healthy and choose to live healthy if you would like to. So what we did is we took a look at, broke down the county into over 140 different little segments throughout the entire community, mostly oriented around census tracts and census blocks. But that's far too many to really talk about in any meaningful way. So the best thing to do is to really pull out those little nuggets there that start to tell the story. And we looked at really 8 neighborhoods across the county, trying to get a mix of both those that are in the urban areas as well as scattered across Lane County and smaller communities. So you can get a sense of both how health can vary very dramatically in a matter of just a mile or two, or as, across the county, an hour-and-a-half drive between communities can have some pretty dramatic differences in health outcomes that play out in those communities. And I think the one thing I'd want to put out there before we really dive into this, though, is that I'm going to talk about a number of health indicators that speak to things that we can measure readily in these communities that really start to speak to the interconnections of those opportunities that are available. But these really aren't the whole story about these communities. And certainly every one of these communities that we'll highlight up here have places and neighborhoods that are struggling more than others, and also others that are doing really well. And there are strengths and opportunities in these communities that just don't get captured in the data. So I certainly don't want to imply today that any indicators are worse off for others than some other neighborhood or community implies that that community is not doing well at all. In fact, there are probably many strengths at work there that we just aren't going to be able to speak to today very effectively. So keep that in mind, because I think the strengths are what we can build on as we move forward in any community that might be struggling with health. Those are the things we can leverage to really create opportunity. So the 8 neighborhoods that we'll be focusing on today are up there on the list. In fact, if you want to go to the map, that gives you a better sense of how the layout is there. But we've got the Cal Young neighborhood and Train Song, which are really not too far away from each other in Eugene. Old Town Florence, east of Ivy and Junction City, so just a segment of Junction City there. West of Highway 99 and east of the Coast Fork and Cottage Grove, so down in sort of central Cottage Grove there. East of Crestview and north of Highway 58 in Oak Ridge, so one segment of Oak Ridge. Marcola and Hayden Bridge in Springfield, and also Main Street and 28th Street, which again are very close neighborhoods in Springfield. We'll notice some very interesting contrasts that go with those communities that are very, very close together. So we looked at several health indicators, and mostly I'm just highlighting these indicators because they're interconnected. And in particular, life expectancy is the one that we're going to put up there as just sort of the high level, good measure of how a community might be doing. It just gives us a good sense of at which health may be not as good or better in some communities. And so that's one we looked at. You may be familiar with the report that was recently released by the Centers for Disease Control and Prevention, which really speaks to the fact that life expectancy can vary quite dramatically, much more so than we'll see in Lane County, but even in Lane County we see differences as much as 10 years in neighborhoods. Looked at heart disease deaths, which continues to be the second leading cause of death in Lane County, and also highly interconnected with life expectancy. Cancer is the leading cause of death. We're not going to speak about that as much today, but adults who smoke, easy access to retail tobacco and the interrelationship between access to tobacco and whether or not a person chooses to smoke. Body mass index as an indicator of really an interconnected predictor for lots of health conditions, including heart disease and overall life expectancy. Easy access to supermarkets as another measure of opportunity and whether or not you can access fresh produce and healthy foods. And easy access to parks and open space as a sense of really access to opportunities to be active and out and about. So as I mentioned, life expectancy. So this table, not easy to scan, but I'm going to try to draw out a couple themes there for you. So life expectancy can really, as I mentioned, be a really good measure of overall health. And in Lane County, the average life expectancy is about 81 years of age. This is averaged out over the last 10 years. It can vary if you just look year to year, but we're talking about 81 years. So you'll see that there are some communities up there that are more than that and some that are lower. And it really varies between a low of about 74 to a high of 84. And you'll notice differences in there, as I mentioned, as much as 10 years difference. And what I will highlight specifically, if you look there at Calyoung and Train Song, those neighborhoods are really less than a couple miles apart from each other and essentially divided by the Willamette River. And yet we see a 10-year life expectancy difference in those communities.
And the rail yards.
Yes, and rail yards, which are a significant barrier as well for in and out of the neighborhood. See, that really speaks to the place again, in particular, those structures and things in place that really divide or create possibilities, I agree. But that's just a dramatic difference. And then you'll see it just varies across the community, but you'll see how some of the other, we have, again, in Springfield, a very similar situation going on there with Marcola Road, Hayden Bridge area, and Main Street, 28th neighborhoods, which are divided by a freeway, essentially. And again, about a 6-year life expectancy difference. And then it varies across the county. But that starts to set the stage there. You can see how quickly, how just even being right next to each other, there can be opportunity differences. Heart disease, which you see up there also, which I mentioned is the second leading cause of death. But it's actually can be intertwined with a number of things which are up there, including tobacco use, your ability to exercise and be active and out and about, access to safe and healthy foods and those sorts of things. So it's one of the reasons why we highlight that. Again, it continues to be a leading influence in life expectancy overall. And what you're seeing up there is actually a measure of how frequently folks die from heart disease, and there's pretty dramatic differences again. You'll notice that as much as 5 times difference, again, just highlighting the difference between Calyoung and Train Song, which I just really draw those out primarily because of how strong the difference is, but you'll see again that there's quite a bit of variety across the board there. Some communities are doing really well overall and close to our overall average, but others are quite a bit different. And this is where I really want to draw the interconnections. So you see up there, body mass index, or excuse me, access to tobacco. And we'll start with adults who smoke across the communities. And you look right below that, the measure of easy access to retail tobacco in any particular community. In general, what you're seeing is a very, very quick or very, very strong connection there between availability of tobacco in a particular community and how many folks in that community choose to smoke, and strong connections with that. So certainly there are opportunities for some neighborhoods who have less access to tobacco are in many ways going to have a more healthy and longer life expectancy. Also lower heart disease. And then easy access to, interrelated is easy access to supermarkets and body mass index. And so we have, this one is a more complicated story. So one of the reasons we wanted to highlight this is because while we're talking about things that tend to be strongly or correlated with one another, the story is not always that simple. There are many things at play. So in this case, body mass index, which is a pretty good indicator overall of other potential chronic diseases and conditions and the likelihood of someone developing them over a lifespan. There's often been conversation about if you have easy access to grocery stores or easy access to parks so that you can be physically active, that you'll likely have lower BMIs. Well, that is true for a lot of reasons, but there's also more to it at play potentially. And so, for example, you'll see a neighborhood there like Calyoung, which actually has very little access to supermarkets within close proximity, meaning you can walk or have a short drive to that supermarket, but you don't have to go very far. If you actually have a car or the opportunity to go to nearby grocery stores, you can go there. Well, that neighborhood happens to be a little more affluent and have actually greater access to vehicles than some other neighborhoods on that
And it
board
has
there.
bike paths.
And it has bike paths and many other ways to connect with neighborhoods. So what that creates is the possibility that that neighborhood has sort of a buffering factor going on. There are some things at play there that can help that neighborhood be more active or more connected with healthful foods. And then again, really a strength that's to call out in our rural communities is a lot of our rural communities have very excellent access to opportunities to be out and about and physically active. And that's also having a buffering effect in some of those communities, or we suspect or would anticipate that's at play as well. So keeping in mind those things, while there are many interrelated pieces to it, and it's sometimes we want to just say, hey, you know, if it's like this, this community will be unhealthy. If it's like this, this community will be healthier. Not always so easy to tease out. But while the story is complex, a lot of times these things are very interrelated, and there's much we can do about them to build better opportunity and better communities. So just to wrap it in or bring it to close, tie this all up, again, just a reminder that zip code and street, where you live and where the opportunities before you have a very, very strong interconnection with the choices you can make as well as your overall health in the long run. And so there's a lot we can do about that, including the policies we choose to implement, the way we design our communities, and the opportunities that we create for folks. And those conditions are much, much stronger predictions of whether somebody's health will be good in the long run than ultimately than their access to health care or the things we often associate with good health. And I think most importantly, since here sitting as the Board of Health, is that policy has a very, very important place in that in particular because it establishes often long-term impacts on a community and sets the stage for opportunities in the future. And we can do much to prevent or mitigate things that cause bad health as well as support, and most importantly, support those things that create good health. So. And I think with that, I'll hand it over to Jocelyn to really transition us into what we can do from here, possibilities, as well as speaking more about the suicide prevention report.
I like this quote from Dr. Williams because I think it highlights some of the things we've talked about here today too, about all the things that impact health. Housing being among the most significant things, but everything that we can do to improve the quality of life for individuals in our society has an impact on their health and is a health policy. So I want to come back a little bit to this model that you saw earlier. This is a model that was put together by the Prevention Institute. It's a very kind of classic public health approach to health outcomes and health problems in our community. The thing we wanted to highlight were the effects of place. So those are the things that we've really talked about a lot here. The things that we don't have as good a handle on necessarily are some of the things around the people who are actually living in those places. And for that reason, the approach that this group suggests when going about developing plans and processes to address some of these issues is going to the communities first. So as Brian highlighted, these are the data that we have, our public health data, and they're just one aspect of a community. They're not the whole picture. So what's most important as a beginning is to engage those communities in the discussion of what they see are happening in their community and what the priorities are. So we've been talking a lot in public health. We've also been working with our Public Health Advisory Committee and the Equity and Access Board about going out to those communities and doing some additional work and doing some meetings. So our plan is to engage with those communities next in thinking about how to talk about some of the things that we've found in this report, in our equity report as well, and some of the things we can do in those neighborhoods and some of the recommendations we can come back to you with for improving the conditions in those neighborhoods. So we're still kind of focused on that first part, engage and partner. So we'll be working with Mo Young, the Equity Access Board, and we'll be convening some additional meetings in those neighborhoods and thinking about a plan for continued engagement in the communities outside of the Eugene-Springfield area, as well as the communities within our urban area. So that really concludes our Place Matters presentation. Then we were going to move to the update on suicide prevention and mental health promotion as requested by the board. I am providing the report in the place of Roger Brubaker, our suicide prevention coordinator, mental health promotion coordinator. He's sorry he can't be here today. I did include some in your packet. I think since the release of our the suicide report that Roger compiled, we've had a lot of requests for training in the community. So that has really been the focus a lot of the work that's been done since the release of the report. It's mostly about, there are both prevention trainings as well as postvention trainings, as we've mentioned before. The postvention trainings have been really successful and are being used now as a model at the state level for other counties that are implementing that program. We're also looking at other events. We had the Veterans Suicide Awareness Summit that Roger organized, as well as the October Community Forum down at LCC. In addition to that, we're also working more on surveillance. There is an innovative program being used in Washington County that Roger is working with the folks there to figure out how we could implement a similar approach here. He's also working on putting together the Suicide Prevention and Mental Health Promotion 2-year work plan in the new year, so that will be coming back soon, probably in February, I believe. And when he's also working with a lot of other groups. As Karen mentioned, we depend a lot on the partners that we work with. So Roger is connecting most frequently with a lot of organizations. He has an advisory group as well that provides input from the community in this work. But I think if you have any other questions about that, I'd be happy to answer those, or also take those back to Roger if I can't answer.
And before we turn it back for questions and comments, I would just add specifically on the topic of suicide prevention. I know one of the things that came up when we met with you and Roger discussed his findings was really working hard to identify additional FTE and resources for this issue. We know that the needs here are more significant than other communities in the state and certainly other communities nationally. So Jocelyn and CA Baskerville, who supervises our prevention unit, and I've been working hard to look at reconfiguring some funding and are hopeful that we'll be able to add at least half an FTE by piecing together some state money and some other funds to really help bolster Roger and his work. At this point, he does all of our postvention work and our prevention work, and we just need to have more resource in that area. So that's the other update on that topic I would provide. And I would ask if you have questions or comments about what we presented today or anything else in the packet around H&HS.
Commissioner Farr.
I'm going to be real short, but first I'd like to talk about Roger Brubaker. My gosh, the work that he does is outstanding. I attended back in June, there's a 4-day postvention training that I attended. I wasn't invited really to attend the whole thing, but I attended the start and the finish and a little bit in the middle. And the amount of work and preparation that went into training the frontline folks on working directly with families and deep into the community regarding suicide, I was amazed. The people were there from start to finish, and they were engaged the entire time. The facilitators that I believe that Roger had organized the entire training. It was just outstanding. I could go on for a long time talking about that. Not long prior to that, Commissioner Lyken and I went to a large group meeting at Valley River, which was the big circle of folks talking about. It's not long after Chloe Wilson's suicide that one occurred. There was a large group of professionals, mainly from school districts and from different jurisdictions, talking about the future of suicide prevention and the future of what really is proving to be Mr. Brubaker's work. So thank you. The energy that you're putting in, you say you need more resources, just ask, and we will certainly find ways to look to find ways to get those resources in place. But the return on the investment is remarkable. The only other thing I'm going to talk about, Train Song. Train Song's my neighborhood. I live it. Train Song is right along Bethel Drive, between Bethel Drive basically and 99. It used to be called the Bethel Triangle. And really it's between two sets of railway lines. It's between the BN and the SP, or UP. I live about 3 miles from there. And, earlier today I talked about Laurie Halber's work with canvassing what is the biggest obstacle when you're involved in homelessness, and that's getting enough sleep. Well, every night, all night long, I hear train whistles, and I'm miles away. I'm actually, 2 miles away from where the Burlington Northern is. And I used to think it was the UP yards that were making all those train whistles, but it's not. It's right at Roosevelt Avenue. There's a train that hangs out there. I swear it's all night long. And every time it approaches from either direction, it honks 5 times. I count it. 1, 2, 3 more. 3, 4, 5, and I can hear it loud. So if we're looking at the social determinants of health, and if we're looking at the causes of unhealth in particular neighborhoods, the folks who live in Train-Song do not get enough sleep. And if they do, it's miraculous, because so they're suffering from sleep deprivation along with some of the lack of access to exercise and bicycle routes, for instance. And you compare that with Cal Young, they're not too far apart. I mean, aerially, it looks like they're very, very close. But if you walk the neighborhood, now we're talking about engaging and partnering, and I'm talking right now about engaging and partnering with our municipal partners. Train-Song neighborhood doesn't have sidewalks, a lot of it. Has ditches instead of sidewalks, and has roads that really have, this time of the year, when it rains, have huge puddles in the middle, making it more difficult for the people who can afford to live there. Now, a large part of it is the affordability of the housing that's there. That it makes it hard for the kids to go to school. It makes them the kids have to cross the railway lines to go to school if they live in the immediate Bethel Triangle. So, when we're looking at what is it that moves families out of poverty and into a more successful economic situation, a viable situation, one of the things is how can we partner with the city of Eugene? What can we do to help the Train-Song neighborhood? I'm not going to go too deep into Train-Song because this is a General Board of Health meeting. We can talk more about that. An urban renewal district in that area, for instance, we have urban blight there. It can be fixed, and it's got to be through engaging and partnering with the city of Eugene. The other thing I'll mention is that last week I was at the Oregon Leadership Summit, and I was at a presentation that mirrored exactly what you're talking about today, Dr. Johnson, about the economics of neighborhoods. That has a large part in your success. And it was Dr. Raj Chatty. Is that a familiar name to you? He's at Harvard University, and he's got a let's see, it's called Opportunity Insights, and their mission is to develop scalable policy solutions to empower families to rise out of poverty. And a large part is, where do you live? And they talk about the mobility of economic success, that living in a particular zip code or census block, he talked census blocks quite a bit. Really, it's where you spent your formative years, and it's getting people in their early years into places where they can be more successful. Now, the best way to do that isn't to move people, is to make the place they live better. Because just moving people doesn't do any good for the people who are filtering into the lowest rent places in town. So the work is amazing. It really is, and the things that we can do aren't just in the lab. The things that we can do are partnering, engaging, and making certain that our civic partners, that the city of Eugene and other cities, Oak Ridge and Florence and other cities, are recognizing ways that we can make people and families' lives better. Poverty and homelessness are the two greatest factors in lack of success and short lives. And name a bad thing. And poverty and homelessness is what drives that. So we can do it, and it's not, Dr. Luque, it's not in the lab, although lab work is wonderful. And it's not in the exam room, but it really is, what do we do in the neighborhoods to make the neighborhoods better so that people don't have to move to achieve a more successful life, greater education, greater health, greater physical health, and greater exercise opportunity. So thank you. Man, your work is amazing. How proud am I to just sit here and listen to it. Thank you very much.
Commissioner Lycan.
Thank you, Mr. Chair, and thank you very much for the report. I'm going to miss these quite a bit. So I appreciate the work that you put into this. A couple things. So when we talk about housing and let me go back to the report itself. You have a lot of, I would call, very good data information. I think you need to sensationalize it or something, because I notice the media is just breaking the door down to come in and gather all this information and report it, but, oh, wait, never mind. I mean, that's kind of sad, isn't it? That this is really important information for our community, but yet we have nobody here to report it. And so it's going to be word of mouth from folks here. But what I want to do is talk about housing a little bit. And what one of the areas I think we're missing, and this has probably been one of the biggest challenges, and so I'm going to look at Commissioner Farr. So who is the business liaison on the Poverty and Homelessness Board?
Pat Walsh is the chair of the board.
Okay. I'd like to read something real quickly, and this came from the, again, I like to use Utah as an example, because they are an example when it comes to housing. The Miller family, and who's the Miller family? Well, Larry H. Miller passed away, but he's the former owner of the Utah Jazz. His family now is the owner of the Utah Jazz, along with many, many other companies. The Miller family will match up to a $10 million in donations for services at new shelters. Who in this community, in the private sector, is willing to step up and match? Because right now, I don't know if the private sector understands, or maybe they don't want to understand. I'm not sure what it is, but there is a real issue here. And I'm not talking about just the homelessness issue, but I'm going to talk about the employment housing issue as well, because this all goes hand in hand. So if things are may end up working out in the positive for what's going to happen in Corning, and with the now that they own the Hynex facility, that could be 2,000 to 3,000 new jobs. Where are they going to live? Where are they going to live? The other issue, and I've said this over and over again, I'm going to say it again, I still believe SB 100, which is our land use system here in the state of Oregon, is a detriment when it comes to trying to create new housing. It really is. But one of the things I would leave with this board is this, and with, especially if your work on the Board of Health, but also as the Board of Commissioners, and that is really engage with the private sector to talk about these are some of the issues. You need to get with different forums, whether it's Chamber of Commerce's, but even more than that, forums that include what I call the large companies, and talk about the housing, homelessness. When Gail Miller, who's the eldest daughter of Larry Miller, is now the chairperson of this company, when she was there at the press conference giving a donation, she had to step away from the microphone because she was breaking up when it talked about homelessness going on in different communities in different cities, whether Salt Lake City, other cities, and other communities in Utah. But folks, $10 million from a private sector company talks very loudly. And if they do it, guess what? Other companies are also going to say, you know, this really is an issue. But they have engaged, and they've been a leader in this. And right now, the leader comes from public sector and don't have enough money. You don't have the dollars. You can provide data, you can provide information. It's hard to get it out to the public. Again, the media is not here today to report on this. This is really important. But I'll leave you with that. And I want to say thank you very much for the work that you've done. And I also want to say to Carson, your entire family, thank you for being here this morning. And because this issue of teen suicide it's critical. And it's going to take young folks like that in our community to bring this awareness and make things happen in a positive way. But thank you for the great work.
So if there's no other questions for the public health staff, I'll remind the commissioners we're kind of going into our 10 o'clock time certain. I'm just going to real quick have a couple quick comments. The whole issue of differential in life expectancy and other issues around health outcomes relative to place, the maps you have, you could make those same distinctions if it was household income. You could make the same distinctions if it was educational attainment by neighborhood, or single family versus multifamily dwellings, ownership versus rental. You get almost the exact same map. So as we're talking about some of the other factors around there, really what we're looking at is we're looking at a a bunch of social factors in that. And I think, you know, as we think about how we've developed our neighborhoods and how we've kind of segregated out some of this, and this gets to, you know, how we've done zoning historically in some of this area, we're developing these pockets because we're not mixing our uses well. The other issue is, as we look at some of those things that are kind of, you know, not what you expected, like access to parks. If you have a single-family neighborhood with fairly large lots, everybody has their own private park for their kids. And the streets are usually much more walkable versus somebody that's living indoors with no outdoor space other than a balcony maybe. So just as you look at that, there's some things that really some of the factors you had up there really may not have told the whole story. I do want to briefly touch on the suicide update. I appreciate that you guys are working in collaboration with U of O. By the way, Angie Long says hi, Pat. One of the people in their public health clinic is a longtime friend of mine that just moved in the area from the DC area, knowing her since way back when. But working together with U of O on some of those issues is really important on public health in general. But I really am looking forward to maybe adopting some of the Washington County leading indicators. You know, the surrendering of pets and the other issues that they've been able to do to try and identify people at risk of suicide and getting those interventions quickly in those cases. So really look forward to some of that continuing work on the leading edge of trying to do suicide prevention based on some other factors. It's always interesting. One of the things that, you know, my experience working with a utility was when somebody gets a power turn off, they're pretty close to homelessness because that's one of the last things people stop paying is their power bill. So that became an indicator to turn some of those accounts over to social services to try and intervene and do some, you know, prevention of homelessness. So this is kind of, now we're looking at some other indicators. And that pet surrender is a huge indicator. And if we can find a way to utilize that, and if we can find some other factors that maybe we don't know of yet, that we can kind of get in there and get in those critical last hours and provide that intervention, it's really, really important. So appreciate the great work that's going on with Roger and appreciate that you're looking for more resource to expand that. Any other questions or comments from the board?
And Chair Bozovich, I neglected to do this during the introductions, but I did want to acknowledge Brian, who's been fantastic as our epidemiologist, is actually going to be transitioning into a new role supervising our environmental health section. And I know many of you have had an opportunity to work with Jeff Lang over the years, and Jeff retired at the end of November. So we're thrilled to have Brian moving into that role moving forward.
Yeah, I just happened to be in my office as Jeff walked by coming from HR going, I'm out of here.
Yes.
So, yeah, congratulations. Well, thank you very much for the
Congratulations to Lane
report.
County. Excellent.
Thank you very much for the report. So with that, if there's no other business for the Board of Health, I'm going to adjourn the Board of Health, and I'm going to reconvene the regular meeting of the Board of Commissioners. And I am going to skip right down. Do we have? Okay. All right, thanks. All right, then what I'll do is we'll do a real quick public comment. I apologize for making you guys wait a minute, but we have one person that came in and signed up while we're in our Board of Health. We'll deal with public comment, and then we'll go directly to our 10 o'clock time certain, and then we'll jump back down into the rest of the board agenda. So we'll go to public comment for the regular board meeting, and we have Chris, if you want to come on up and state your name and where you're from for the record, and I'll start the timer for your 3 minutes.
Good morning, Chair Bozovich, esteemed commission. My name is Chris McAllister. I come from Springfield. I'm here to talk to you about homelessness here in Eugene, Springfield, and Greater Lake County. I serve at your pleasure on the PHB. I am a representative of the consumer block. I'm also chair of LEAGUE, which is our Lived Experience Advisory Group for Unhoused Engagement. We like acronyms that are words. So with that in mind, we had the honor of having this county administrator as our guest last week, and we got to ask some questions about Highway 99 and some of the other things that are going on. And we felt the response was very candid and very informative, and we feel like we can better navigate in some of our decision advising going forward based on some of the conversation that we've had. I just wanted to thank you for some of your efforts in helping us trying to find sites here in Lane County for unhoused. We have a very big problem when it comes to citation for illegal camping. We do not have anywhere for people to go once they've been cited. And so they're pushed on. We have people who've had fires. Their items have caught fire and they can't go anywhere, so they can't be put in a park. We have to repair these items, get them cleaned up just so they can even possibly be put in a park. And what's often offered to our low-income people are not at a cost value that are allowed into our current parks. So please, at least for the winter, consider some options for people who have nowhere else to go, including those who are constantly pushed on by our law enforcement because they're following codes. So I appreciate your service. I appreciate all that you've done for the PHB, and we look forward to working with you soon. I am here speaking on my own behalf, not on behalf of the PHB. Thank you for your time and your service.
Thank you, Chris. I'll offer commissioners if they want to respond to Chris's public comment before we move to our 10 o'clock.
Only one quick thing, Mr. Chair, while Chris is here, I have more after the 10 o'clock. But Chris, I just want to personally thank you for the attention to detail that you provide to the Poverty and Homelessness Board and far beyond the Poverty and Homelessness Board. You give us insights that we otherwise would not get, Chris. Thank you for all of your work. I thank you quite often. This is a chance for me to do it right here at the bully pulpit with the mic in front of me. Thank you, Chris.
And I just want to say thanks, Chris, for your support as we were trying to work on the overnight camping ordinance up in the Santa Clara area. Your help at the public meeting was great, so appreciate that.
And I'll just add, he's a very passionate individual and glad to have him part of this, especially representing my city. And Chris, job well done. Excellent. Thank you for doing what you do.
And all those 1 a.m. calls, Chris, keep making them. That's fine.
So I'm going to jump down to item 8B on our agenda, which is our 10 o'clock time certain, almost 10 minutes late. It's our update from the Oregon Extension Service. It's our quarterly update that we asked for as a board to have regular updates from them because it was not enough time to do the entire extension program in one sitting once a year. So we have Lauren Grand, our extension agent in forestry and natural resources here today, and I think we're going to talk forestry today.
We are. Good morning, Commissioners. Thank you so much for this opportunity for us to talk about extension and for me to have the opportunity to talk about forestry and natural resources, my personal love. My name is Lauren Grand. I'm the Lane County Extension Agent for Forestry and Natural Resources. I get one of the small honors to be able to focus on just one county, so I'm really excited about that. I was hired 2.5 years ago to be able to fill this position that hasn't had forestry education through extension since 2010. And so I'm really excited to bring back programming and information to the community about forestry and natural resources. Here's some of the things that I've been working on since I started just over 2.5 years ago. We had the first forestry conference for the OSU Extension Forestry and Natural Resources team in 14 years here in Lane County. We invited stakeholders from the county to be able to learn about local forestry and natural resources, landowner properties, as well as opportunities for safe harbor agreements for the spotted owl through the Department of Forestry for private landowners. So we did a tour of different forests in the Florence area. And we also worked on a forestry needs assessment. So because I hosted this conference, I also did a Lane County needs assessment to learn about what the residents of Lane County who are interested in learning more about forestry and natural resources, what their needs are within our community. And so we learned a lot. We found that the top 3 needs are forest health information, so insects and diseases that are ailing our trees, as well as wildfire protection information, and wildlife conservation information. So I've been able to put on 3 different short courses called Introduction to Woodland Management. We've been able to have 45 participants. It's a series course, so it takes quite a commitment to be able to come to multiple classes and learn about forestry, but it's a great opportunity for people to get a basis information. We start with identifying native trees. So it's really the foundation of forestry and natural resources, and people are learning about their property, their objectives and goals for that property, and what they can do to keep it healthy and productive in their own eyes. That has fueled into some people and some new people taking our Master Woodland Manager program. Master Woodland Managers is a volunteer program where people can get a little bit more advanced information about forestry and natural resources, and they become volunteers in the community. So they share what they've learned about their own management as well as forestry and natural resources around the state, and they go out and help me do site visits to landowners who have questions about sick tree calls or how they can make more habitat for wildlife or reduce their wildfire risk. And we have 26 graduates, which is my understanding is the largest Master Woodland Manager class in Oregon State in history, which is really exciting since it's the first year we've been able to do it since the 90s. So it's a really needed program here in Lane County, and I'm really excited we got to bring it back. And they graduate on December 13th. And their promise to us as after taking this course is to provide 1,248 volunteer hours, just the minimum hours that they're promising. We're hoping that they'll continue to go further and do more volunteer hours in the community afterwards. We were able to bring Tree School back to Lane County, which has only happened one time before since Tree School was started. We had 26 different classes and 122 participants that were able to take 4 classes each during that day. They provided professional continuing education credits for loggers, foresters, and for arborists to be able to continue their professional career, as well as just anybody who is interested in learning more information were able to take those classes. We had topics on fire, pollinators, forest health, wildlife, harvesting, Native American stewardship, chainsaw safety, and lots more. So people were able to get lots of information all in one day. I was able to do, I realized when I started, there were a lot of people asking me that they were interested in cutting a few trees that have died on their property, or interested in harvesting some trees, and they really didn't know where to go or where to start. And it's one of the things that a landowner can do that can help them reach their management goals, but also is the most risk-filled management action that a landowner can do, because they're at risk for economics, they're at risk for damaging their land, and they're at risk for not fully understanding the whole process or getting the most out of their logs. And so it's really important that landowners are informed about the market, informed about how to interview good consulting foresters and loggers to make sure their land is taken care of the way they best know how. And so what we did is create a program where landowners could learn all the steps and facets of selling logs from their property safely to minimize their risk as a landowner. And we had 72 participants just in Lane County take that class. And from that, we earned $23,000 in grants to make this a statewide program in order to write a curriculum for the entire Western United States, because people in forestry found that this was such an important program. And so we've done one more conference in Oregon City, and we plan to do 2 more in the state. Oregon Forest Management Planning is a website that I've been able to work on with some colleagues, and it's really important for landowners to be able to know what they want to do and where they're going with their property. And so this is a website that landowners can use and access to get more information about how to write a management plan. Gives them information on where to get help and how to get resources, like what water's on the property, what cultural resources there are, what wildlife, threatened and endangered species there are, so they know what they can protect and also know how to manage the different trees for whatever their objectives are. We've been able to bring 4 different sessions of the Oregon Forest Pest Detectors course. This is a program that's geared towards natural resource professionals in early detection of invasive insects, specifically emerald ash borer and Asian longhorn beetle. They're not here in Oregon yet, and we hope to keep it that way, or at least as soon as they're here, detect them as soon as possible to be able to eradicate them as soon as possible. So this was a program that was developed by my colleagues, and we were able to offer it here to 68 different natural resource professionals so that they can keep their eyes out and make sure that they know as soon as possible when those insects arrive. My colleagues have also started a program called Oregon Season Trackers, which relies on volunteers to be able to take precipitation data and also plant phenology data. And these go into databases, national databases, where scientists at Oregon State University and H.J. Andrews use information about precipitation levels. And also the timing of when plants leaf out, bud out, and go dormant. It's really great information so that we can learn as climates change, how ecology changes, and how different plants will respond to that. And we have 10 new volunteers in Lane County that collect data for this national program, and I'm looking forward to hosting another program in 2019. Wildfire has become increasingly important in the recent past. I'm sure many of you have heard lots about it. I've been collaborating with the county on the Community Wildfire Protection Plan. I'll be doing a needs assessment for them so we can find out how the plan can address the needs of Lane County residents. I've personally worked on publishing some fire FAQs with the fire program at Oregon State so we can answer questions about those hard-hitting questions about fire. I've done a Facebook Live program with Rick Dancer on how to protect your home from wildfire, and I was interviewed by KVAL News, so I'm really trying to get the word out and get people informed about how to protect their home from the incidents of wildfire. And then we've put on 5 different workshops in collaboration with the Oregon Department of Forestry as well. So I personally have worked on a few publications that go directly towards landowner management, and we're putting out a newsletter and information on other things just such as planting, wildlife cameras, how to use drones on your property. So landowners are getting the cutting edge information from the university as soon as possible. I recently received a grant from the University of Minnesota to help with a program for residents of the community to become empowered to work with community leaders on being involved in decision-making around invasive species. And so we're doing a program in 2019 on how landowners can talk to different people who make decisions on invasive species management about what their interests are in the community and reducing invasive species, which is one of the larger forest health issues, I think, in Western Oregon. And then we've also developed a Canopy View News, which is a newsletter for all the forest enthusiasts of Lane County, I like to say. I've collaborated with Douglas County, so we're doing this together. We have 400 subscribers just in Lane County, so people that are interested in the information I have to share, this was the most recent newsletter that we put out. And then we also have a local chapter of Women Owning Woodlands. And so this is a statewide program that works to encourage forest literacy among women and forest management. We have 25 members in our local Lane County chapter, and we just did a workshop on collecting floral greens, and we made some wreaths. And so some people actually use this as a economic benefit to themselves. They collect floral greens and they sell centerpieces and wreaths and have other income opportunities from non-timber forest products.
I used to make a lot of money doing that in the Tillamook Forest.
Yes, very lucrative. That's my first wreath there on the left I've ever made. It was very exciting. And that's all I have today, so happy to answer any questions for you.
Commissioner Sorensen.
Thank you. Could you go back to the forest fire defensive space? There it is. My understanding is that that your focus, of course, is on educating people about the need for the minimal density of the trees in that structure ignition zone, particularly the 30 to 100 foot part of that. And do you know anything about the rules, the Lane County rules or the Douglas County rules or anybody else's rules, maybe state, regarding those zones?
I am familiar with some of the rules. I
Yeah.
know that new construction in Lane County requires a defensible space of 100 feet, is my understanding.
So is that the 30 where there's just a little bit of few trees and then there's more trees in the 30 to 100 foot area?
Yes, so this is sort of this is the map that sort of come up from the national wildfire, what's the name of it? NEFA, it's NEFA. I can never remember what the letters stand for. But the research suggests that if you have scattered individual trees and groupings of small shrubs separate from those trees within the first 30 feet, then you're able to slow down and bring down the fire rate as well as flame lengths in order to have the fire burn around the home and keep moving to reduce the amount of radiation heat that could combust any of the materials on your home. And then as you move further out to the 30 to 100 feet, you can depending on where you are in the country and the fire risk on that landscape, you can have increasing number of trees between 30 and 100 feet, typically further spaced. Here, actually, in Western Oregon, it is actually okay to have more trees closer together that creates high moisture and shade on the ground. And then with minimal ladder fuels, and then as you get closer to the home, that's when you have the heavily managed area so that the fire moves around the home.
Okay, and is there any way to, express this in some kind of code?
In
Like
some,
to say, well, what we mean by that 0 to 30 radius is, what do you have there? 1, 2, 3, 4, 5, 6, 7 trees in that radius. And then what we mean by the 30 to 100 is, X number of trees. In other words, is there a way to in a fire code, CAL FIRE or some other larger agency, is there a way to actually quantify what that should be? To lower the risk of something like that big campfire, that type of thing.
sure, there have been some guides, specifically by the FireWise Communities Network and team that have come out with actual numbers, including having more to do with the distance between the vegetation as opposed to the actual number of trees. They've said things like keeping your trees pruned to at least 3 times the height of the shrubs that are close by, and having shrubs at least 3 times the distance, groupings of shrubs 3 times the distance from other groupings of shrubs, no branches within 5 feet of a home. There's guidelines such as those that are available that could potentially be used in code, I would assume.
Well, thank you very much, and thanks for all your great work.
Yeah.
Commissioner Lycan.
Thank you, Mr. Chair. This was really good. I really appreciate this very much. I did have to snicker a little bit when I saw chainsaw safety. When I was a kid, chainsaw safety was when you go out there, don't cut your leg off. Yeah. So that was chainsaw safety when I was growing up. But anyway, my grandfather had a mill and my great-grandfather had a mill, and so I kind of grew up around that industry. My question to you is, have you had a chance to sit down and maybe take this and present it to OFIC, so Oregon Forest and Industry Council? That's one. And AFRC, which is American Forest Resource. both of those organizations, they're here. And they have, and the reason why I say that is because while they represent private industry, I think that something like this, I think they would really be interested in this. And they're also organizations that can come up with potential grant money. And really because I think what you've done here is you have presented in a way that is very user-friendly for the everyday public. When you get in these and you talk to folks from these different groups, this is their livelihood. And so when they talk about issues going on in the forest, it can be pretty detailed, pretty strong in their narrative. But this, I really like this because it's easy to understand, and which I really appreciate, but it's easy for the public to understand. And you're making it to the point where when you talk about forestry, what's happening in the forestry, forest management, it's not to the point where it sounds offensive or anything else. It's just being practical. And I really do appreciate that very much, what you have presented here today. And thank you for doing that. But I would just offer that up as something to think about, and make contact with the respective leadership of those two organizations and just ask if you can present on the behalf of the extension so that they can actually be your supporter, which I think would be really, which I think in the long run, I think would work out quite well. So, but thank you for your presentation. It was very, very easy to follow, and I think is very well done, and appreciate that. Thank you.
Thank you.
Commissioner Farr, then Commissioner Williams.
Thank you. I wondered, Lauren, if you could confirm something for me. I've been wondering, is the age-old secret to tree planting, is it green side up, brown side down?
Somebody's read my article recently.
I've read your article, yeah. That should be that's great. I just wanted to say the Canopy View News, what a great publication that is. I'm just looking for the first time at the newsletter. It really is. It's full of great information.
Great, thank you.
Stuff that could be made into brochures and handed out. You know, in a former life, I was the manager of Gray's Garden Centers, and people would always be asking me how to plant trees. And I wish I'd had this checklist that you have right here. It's fantastic. So thank you for the presentation today. Really informative. It's really wonderful to know that you're on the ground and in the ground. And I subscribe to the Canopy View News. Looked at your website, and good work. I'm excited about the future. You're graduating 26 on December 13th. What time of day is that?
Let's see, the actual graduation will be in the afternoon between 1 and 3.
Okay. And between 1 and 3, what's the location of that?
It'll be at our extension office.
At the office. Okay, and they've promised you 1,248 hours of volunteer work?
Yes.
Oh my gosh. That's about 48 hours per person approximately.
It is, yes, that's how many hours that we train them for, and so they're returning those hours back to the community.
And one last question, is the rust color, is that the uniform of the extension agency?
We're just office mates, and we seem to have ESP now, so we've dressed the same.
Great presentation. Thank you very much. Thank you, Patty.
Commissioner Williams.
Thank you, Mr. Chair, and thank you for the work that you do. I always find these updates refreshing and very, very interesting. Two things. One of the slides talked about trees and planting trees, and I'm reminded that when's the best time to plant a tree? 20 years ago. Second best time is now. So a little something for the edification of others on that regard. My specific question is, as you brought up invasive species, in particular the Asian longhorn beetle, and the threat that it poses. Is that beetle already in the United States or in the western portion of the United States?
It is in the United States. It's in the eastern portion of the United States currently, and we're trying to build education around not moving firewood so that it stays there. And luckily, the Asian longhorn beetle has been eradicated when found in some states, whereas it has not happened with the emerald ash borer. So we're hoping to keep them both out of the state, but doing the best we can to eradicate them if they come. So.
Well, I did a little Google while you were having your discussion, and there clearly is the Asian longhorn beetle, but there are a lot of other beetles that look a lot like that, the citrus beetle being one of them. And as a guy that raised a couple of boys many years ago, we had bug collections. And I looked at this Asian longhorn beetle, and I thought, my gosh, that was like one of our premier bugs in our collection. But now, looking through the Google thing, seeing, it could have been a citrus beetle or something else, but invasive species are something that we need to be very mindful of. The zebra mussel that comes in on flotsam and watercraft and different ways of different vehicles in getting to our shores. One of the things here at the county is reintroducing an herbicide spraying program to specifically address difficult areas to access by hand to eradicate weeds, but the invasive species that we see a great deal of being introduced, and I don't remember the exact name of those vegetative invasive species, but they sound really tenacious and that they really thrive in our environment. And so, so I'm reminded of that when we're talking about invasive species. There's it comes in by the sea, it comes in by the air, it comes in by recreationalists and travelers. And so, very much enjoyed your presentation. That particular thing on invasive species kind of hit the aha thing in me, and we're looking for that Asian longhorn beetle not to be here, but if you're looking for it, there have probably been some examples that why that should be on the radar screen. So thank you for that, and thank you for your great presentation. Thank you, Mr. Chair.
Thank you. Yeah, that was knapweed, I think, was one of the ones that you were thinking about, that actually travels by lawnmower, which is one of the reasons why we need to control it with chemical control versus mechanical control, because it will rebloom at lawnmower height. And is a really problem for hay farmers. It ruins hay crop. But, so, yeah, I appreciate the presentation, particularly talking about, disease, invasive species, and fire resilience. Really important. That particular one of the things our code does take into account also is slope, which that diagram does not. It makes a big difference in how much of a buffer you want, on how far you go, is really depending on how steep the slope is relative to the structure. So there's also another piece in there, and that is actually in our siting standards for the forest zones. We wrap in all of those issues around fire protection, and was developed in the early 90s in conjunction with a lot of fire prevention folks in ODF and all that. There was a big committee in the early 90s that adopted our forest land siting zones for structures out in the forest land. I will say we do have a piece of our code right now that deals with nuisance vegetation. That we have some vegetation written into our county code under Chapter 5, 7.20. Unfortunately, if we added, vegetation relative to fire protection to that, we don't enforce our vegetation code right now. We don't have the resources to. We haven't for years. It's the one piece of code that is written, but we don't enforce, which is just, so adding additional fire, vegetation standards to that piece of code that we don't enforce just doesn't make a lot of sense at this time. At least in the permitting process for a structure, we can at least, when it's originally sited, try and get it sited in the most fire resilient way we can, but to try and, make sure people maintain that, we just don't have the resources to go from house to house. So I really appreciate having OSU out there, and through your extension of your volunteers, keeping the public educated on the need to maintain those fire buffers that we established originally when we site a structure. So that you're that piece that we really need, because we don't have the resources to send people around and inspect homes and then write tickets and then go through enforcement actions, when it comes to vegetation. We're having enough of a time just keeping up with properties that have illegal camping, drug abuse and, dumping and everything else and horrible environmental issues, let alone trying to keep those straight versus whether somebody's kept their ladder fuels under control. So I really appreciate that role that you all play. So is there any other questions? I really appreciate, the extension staff coming back and getting a little bit deeper dive into each program. We initiated these quarterly updates based on the fact that we had a annual update when you guys came in and the clock ran out before we even had a chance to ask questions. So coming back in individual pieces is really great because it gives us a chance to understand the program. And we all know that extension is a partnership between the land grant colleges, the counties, and the federal government. It's not one entity or the other that actually makes extension happen. So it's a cooperation between those three entities. So appreciate the updates as we are a partner in having extension here. So thank you.
Thank you very much.
So with that, I'm going to jump back in our agenda a little bit here and just double check if there are any other adjustments to the agenda. We kind of skipped that today than the ones we've had to take just due to timing. I will remind the board we have executive session this morning. And it's going to be rather lengthy that we want to try and get in before lunch. So if there's no adjustments to the agenda, we've covered remonstrance earlier unless there's additional remonstrance from commissioners. Seeing there's no additional remonstrance, I'll check to make sure. Is there any emergency business today?
No.
That gets us down to the consent calendar, which are items that are considered routine by the Board of Commissioners. And if there was a desire to discuss an item, it would have been pulled during adjustments to the agenda, which we just checked on. So I will entertain a motion to approve the consent calendar. Commissioner Lyken.
Thank you, Mr. Chair. I'd like to move approval of the consent calendar for December 11th, 2018.
Second?
It's been moved by Commissioner Lyken, seconded by Commissioner Williams to approve the consent calendar. All those in favor, please say aye. Aye. Any opposed? Motion passes unanimously. That gets us down to County Council. I already said we have exec session. I don't think there are any other announcements, which brings us to County Administration announcements. Mr. Mokohiski.
Mr. Chair, just a few brief announcements. Positive news here on a few fronts. I want to let the board know that at the request of Grace Serbu, we've been working on converting the currently vacant salmon pod into a youth homeless shelter. And so that's ongoing work that we've been doing in partnership with, as the board knows, the Serbu family has long been a partner in that campus, contributing millions of dollars to the construction of that, of our Juvenile Justice Center, as well as annual operating costs. So we've been working in partnership with Ms. Serbu and the City of Eugene on that. So we'll provide more updates as we near completion of that work, but I just wanted the board to, again, be aware of that positive development. Really positive news on our combined giving campaign that we do every year in engaging our employees in contributing towards charitable organizations in our community that do incredible work both through United Way and EarthShare. And we're really pleased that we have the highest participation rate and the highest total dollar amounts raised this year than we have in the past 3 years. So we've raised over $60,000 and we have over a 20% participation rate among our employees. I want to particularly call out County Council, Human Resources, and County Administration Division that had 100% participation, which is outstanding. Technology Services had almost 50% participation. Assessment and Taxation had 63% participation. So really outstanding. There were over 20% of our workforce participating. In addition to the great work that our employees do every day, that we have over 20% of our workforce that is contributing towards organizations doing great work in our community. And finally, as we've talked a lot about recruitment and retention and turnover in Lane County, and that's been a focus over the past year in particular. We made a number of investments in creating a connected and focused workforce development through development of our leadership development programs, our exit and stay interview programs, our new supervisory development programs. We actually have, of the 42 individuals who've gone through our leadership development, our emerging leaders program, I believe 6 of those individuals have received promotions in the past year. So this is what we're trying to do, is really invest in our employees, give the training and development needed for our employees to continue to advance. So I'm really pleased to report that as of yesterday, with just about 3 weeks left in the calendar year, we currently have the lowest turnover rate in Lane County that we've seen in the past 7 years. Actually, the highest turnover rate that we had was in 2012. Nearly 19% of our workforce turned over that year. And then we trended about anywhere from 11 to 12% for several years. Last year, we had a 15% turnover rate. And this year, we're on pace. We have approximately 10.2% turnover rate in Lane County. So that's really positive, I think. We continue to see, a number of employees that are eligible for retirement, so we'll continue to see retirement turnover happen there. But, and I think, we've talked to the board about is there's a healthy attrition rate, and for local governments, the healthy attrition rate really is somewhere in the range of 10 to 20%. That, you want to see some turnover in your organization so that we're allowing for opportunity for individuals to continue to grow and move throughout the organization. If there were no open positions in the organization because people weren't leaving, there'd be very few, if any, opportunities for employees to move up in that chain of command. And so you want to see some turnover rate, but if you get too high, you start to see challenges, and it could be an indicator. And so I think we continue to be in that healthy range and really positive news there. So I wanted to share that with the board. That's all I have this morning, unless you have questions for me.
Questions or comments for the administrator? Seeing none, I am going to move Commissioner's business to the end of the day this afternoon, because we do have a long exec session. I want to make sure we can get it in before lunchtime, the lunch break. So with that, I am going to recess the regular meeting of the Board of Commissioners, and we'll reconvene an executive session in our Board of Commissioners conference room. And then after that, we'll recess and we'll reconvene in regular session here in Harris Hall at 1:30. The Board of County Commissioners will meet in executive session to consult with counsel concerning the legal rights and duties of a public body with regard to current litigation or litigation likely to be filed. This executive session is held pursuant to ORS 1926602H, which allows the Board of Commissioners to meet in executive session for the purposes listed. Representatives of the news media and designated staff shall be allowed to attend the executive session. All other members of the audience are asked to leave the room. Representatives of the news media are specifically directed not to report on any of the deliberations during the executive session, except to state the general subject of the session as previously announced. No decision may be made in the executive session, and we will be coming back out in public session at 1:30 here in Harris Hall. We are now in executive session, and we'll move to the Board of Commissioners conference room.